NHS England has attacked senior doctors for charging what they call rip-off rates for overtime. In a bid to cut waiting time, some hospitals are allowing consultants to make more than $200,000 a year for additional work. That's nearly double the average basic pay for a full-time consultant in England. Now, many of the consultants earning the most from these huge overtime rates of around £200 an hour are thought to be part-time. Now, that obviously allows them to work significant amounts of overtime. So, is this a price worth paying in order to cut waiting lists, or is it ripping off the taxpayer? Andy, what's your thoughts?
I think it's good news for all of us that waiting lists are being cut, and that is going to come at a cost. And if you want experts to be doing it, which of course we do, these people are highly expert and highly skilled. We need to pay for that. We are not allowing people into this country to do the job for us. And if we were using agencies, it would cost more. So these are the people to do the job. Do I think it's great that they're earning £200 an hour? That seems like a lot. But I'm sure Carole would believe in free commerce and demand and supply. So you would back them up in naming their price.
Please don't tell me what I believe. You know, this would be the same doctors, of course, who, when they were striking, were saying the NHS was in dire straits and it needed more money to help patients. And here they are, ripping patients off, cheating the system to actually at the expense of patient care. This is not just cruel, it's cynical beyond belief. And some of these consultants are actually going on part-time. They're working part-time so as they can work the rest of the week on overtime and earn up to 200 grand a year on top of their salary. This is all at the expense, you know. They get all this money. The government in the budget just allocated 22 billion to the NHS. We know already that half of that money is not going to go into patient care. It's going to go into paying pensions. And last year, 1 billion quid was spent on overtime for these doctors. This is shocking beyond belief.
Or we could argue that actually these are doctors who have served their time in the NHS.
No.
They now want to go part-time, and in order to help the NHS and help patients who are really suffering at the moment, they are doing the overtime and therefore should be paid for it. The supply and demand argument.
When the doctors were on strike, their union, the BMA, told them all to charge sky-high rates to do overtime so that they would so far strike cover, and those prices have stayed. This is a cynical manipulation of NHS funds.
The strikes carried on for such a long time, by the way, let's say, which is part of the reason for the waiting list, because the government didn't negotiate with them and give them fair pay.
These doctors get enormous amounts of money to start with. They're on 150 grand a year minimum before overtime. You know, when a nurse works overtime for an hour, she gets 1.5 times the hourly rate. When a doctor ordinarily works overtime, they get 4 times the hourly rate. So this is... is there any doctors around now that work now because they care about patients, or is it all about money for them? That's what it looks like.
There is a feeling, Andy, and we will have to go over into the break, but there is a feeling that actually doctors are going part-time because it works out better for them. Yeah.
The reason there is such a demand here for doctors to be working overtime is because the last government underfunded the NHS and created this problem. OK,
well, we're going to be taking your calls on this after the break on whether it's doctors to earn over £200,000 from doing overtime. 0207 862 2222 is the number to give us a ring on this one. NHS England has attacked senior doctors for charging what they call rip-off rates for overtime in a bid to cut waiting times. Some hospitals are allowing consultants to make more than £200,000 a year for additional work. But is this a price worth paying in order to cut those waiting lists? Let's go straight to those calls and speak to Candy from Kent. What's your view on this?
Oh, good morning.
Hi.
Hello there. I think it's absolutely worth it. They are saving lives. How much do you value a human life? I think that they are definitely undervalued in this country, and they have got qualifications, they've got knowledge, they've got expertise and skills that the rest of us can only dream about. They've managed to get those skills, qualifications, etc., over 15 to 20 years. And their basic pay, as with all healthcare professionals, has sunk to a very low point over the last 15 years, with the 6th richest country, but it certainly doesn't feel like it in the NHS.
Candy, how much do you think that the average consultant gets paid?
I know, because
tell me.
NHS, But when they go abroad,
tell me what they get paid now. Tell me what they get paid.
Something like you're talking about a consultant. Between 90 and 120 something,
They get paid 100 up to 150, and then overtime after that, and they all claim overtime. Not to that, I didn't know about this level, and we had to find out about this level of overtime from a freedom of information request because it wasn't freely available to us.
I want to put that to Candy. Yeah. What about the accusation that actually they're sort of working the system? The consultants are taking part-time positions in order to earn far more money over time, and that kind of rips off the taxpayer, does it not?
Yeah, well, they pay taxes on that amount. And also, don't forget that they are emigrating like they've never emigrated before to get a wage and a lifestyle and a work-life balance commensurate with their worth. These people haven't just stepped into a job. They've been collecting all their skills and qualifications over many years.
Exactly.
And I
so do lots of other professions.
So hold on, I just want to get to the bottom of what Candy's saying. So are you saying that actually fundamentally to stop consultants, what Carole would accuse of working the system or gaming the system, we should actually just pay them that wage for a full-time job?
Why wouldn't you? Why wouldn't you pay somebody what they're worth? They're saving lives.
Do you know why you wouldn't? Do you know why you wouldn't? Because, Candy, you and the people you care about, and all of us in this room and the people we care about, are getting second, third-rate care because of massive salaries within the NHS. They only got given 22 billion quid in the budget, and $1 billion of that was for last year's overtime. I mean, it's outrageous. And I don't see why you're not.
Hold on, Carole. Wouldn't we have to pay them less if we had more consultants and we had more doctors? But we don't have more consultants and we don't have more doctors.
Candy's
and why
talking
is that?
about people going abroad and getting paid bigger money. The doctors going abroad getting paid bigger money are going to work for healthcare systems private systems that are not free at the source. So that's how they're getting more money. Yes. But we don't. There are lots of people in this country who don't want that for this country. So that's why the wages are slightly lower. We have for years
disincentivised people from training to join the medical profession. We've cut funding for the NHS.
The BMA did that.
We've stopped people from coming to this country who are highly qualified, who can actually support the NHS. We've moved the NHS towards a situation where it's using more and more agency workers. All of this under the previous Conservative government. And I'm sorry, I would gladly, if my mum were told she had to wait 6 months for an important operation, I'd gladly say, I'll bung him 400 quid.
OK, Candy, thank you very much for your call. Lisa from Anglesey, what's your view on this?
I just wanted to say I totally disagree with you, Carole, and you have got your facts wrong there about...
What have I got wrong?
You've got your facts wrong.
What have I got wrong?
You've got your facts wrong, saying that consultants get paid 4 times over for overtime. I know that because I'm married to a consultant. I know that, Carole, because I'm married to one.
Good.
So you've got your facts wrong. I know many consultants who work for the NHS.
This is a matter of record.
No, listen.
No.
And secondly, when you said, do any doctors out there still care about their patients? My husband gives his life to the NHS, and so do many other consultants and doctors out there. And they have to be in university for 7 years, Carole, which is £140,000 debt.
So do lots of people.
They don't get bonuses
study
like
for
jobs.
Can we just
they
listen
work
to
for every penny they get. I'm sorry, you're bang out of
order.
Hold
on, Carole, can we just listen to Lisa?
I echo everything that Candy has said, everything she said. They are worth every penny and more.
OK, Lisa,
and I know that because I live the life with a consultant and I know what he puts into it.
OK, Lisa, hold on, I just want to ask Lisa a question first. Your husband, is he part-time or full-time?
He's full-time.
Oh, OK, so he does work full-time. Well, what about the criticisms for consultants that are taking part-time positions, leaving much more time free in order to work overtime to earn more money, and maybe even earning more than your husband, who will be working the same hours?
Yeah, I agree with that. But also, if they got treated a little bit better by the government and appreciated, Carole, in this country, by people like you, that they wouldn't go and do so, would they?
You don't think they get paid decent money now? Storm just asked you the question about these doctors who are literally gaming the system, where they are going on to part-time purposefully because they know that they can make up the rest of the time in the week and get 4 times and get 200 grand extra a year. Now, no one's accusing your husband of that. This is not a personal attack on your husband. This is an attack on a system that is allowing that to happen.
I know what you're saying. But it is a personal attack when you're saying, are there any doctors still out there that still actually care?
Because when I hear that, your husband obviously does. But when I hear about doctors going part-time so that they can earn twice as much as their salary in overtime to game the system, because that, Lisa, is taking money away from patient care. And I'm sure your husband would agree with that.
If they got treated a bit more with respect, Carole, in this country...
They do get treated with respect.
Okay. They do not, Carole. I live with a consultant, so I know what he puts into that NHS, and I know many other consultants that do so too.
And he'll also be aware of the endemic underfunding of the NHS that has created these waiting lists in the first place.
So it's underfunded, and yet it's okay for them to claim £1 billion in overtime.
I want to get as many calls in as I possibly can. Lisa, thank you very much for your insight on that one. Mandy from Bedfordshire, what do you think? £200 an hour for a consultant doctor, does that seem reasonable to do a bit of overtime?
As 25 years working as a nurse in the NHS, my thoughts would be, why are hospitals allowing a consultant who is a head of department, who is the most senior doctor available on a department or a ward, to work in a part-time contract? Why are they advertising a part-time contract? Why can't it? That would never be allowed in certain positions with nurses, i.e. ward manager, deputy ward manager. So why are we allowing them very top to be in part-time contracts in the first place?
And Mandy,
allowing them to work extra hours.
Well, perhaps because there isn't enough of them and it's a demand and supply. I don't have the answer, but very good point, Mandy. Thank you very much. Anne from Leicestershire, I want to get as many calls in as possible. Anne from Leicestershire, what's your thoughts on this?
Yeah, hello. I'm not quite certain if these rules still apply. But years ago, the consultant had to go and put in a certain amount of hours with the NHS patients before they could actually go and work privately. If they went to work privately, every procedure privately paid for by insurance companies has a code of a certain amount of money and no more. It's a bit I'm saying is the fact if they are being paid £200 an hour, well, maybe this is something the NHS should answer as to why they are paying that money. I'm sorry, but I don't think you can justify £200 an hour, but I do think that they do have to meet a certain criteria if they went to the private sector.
I think we're conflating... Sorry, I think we're conflating two different situations here. We're talking about consultants in the NHS working part-time in the NHS and then earning double that or more than that on overtime.
Okay. Under those circumstances,
Yep, Anne, very quickly, because I've got to move on.
Under those circumstances, then there should be the same setup for those that want to work privately. Those that want to do overtime in the NHS should therefore complete the set amount of hours required by the NHS.
They may do because they work part-time, so it depends on where you set those hours. But Anne, thank you very much for your point. I think I'm going to have to move on. Do you want one quick point?
Doctors' contracts allow them to opt out of weekend working. A lot of them are, and then they're charging overtime for that.